In an ideal situation, couples who intend to become pregnant are required to see a midwife or a gynecologist to be seen through a series of tests, education, and assessments to evaluate whether they are healthy enough to go through pregnancy and even labor. Preconception care covers a wide range of assessments. One of them is obstetric history. Under obstetric history, the number of pregnancies the woman has had is taken into account, including ones she has lost, whether induced by herself or lost spontaneously, the ones she has given birth to, the ones who are dead, the ones she has miscarried. All these come together to form the obstetric history of the woman. Another assessment is the reproductive life plan of the couple. We talk about the number of children they intend to have and then counsel them on the appropriate family planning method they can choose to help them space their birth. In addition, medical assessment of the couple is also done. Here, one important factor to be noted is that the couple is assessed, taking through a series of conversations to find out if they have any underlying medical conditions, which requires that they take medications. Okay, this is because there are some medical conditions which are escalated by pregnancy, and there are some that also puts the woman in danger if she has that condition. Some of the medical conditions that can escalate during pregnancy includes diabetes, asthma, and hypertension. If a woman is hypertensive before pregnancy or develops hypertension during the pregnancy, it can cause placental insufficiency to the growing fetus, and then in turn cause intrauterine growth restriction. So you realize that in this case, the pregnancy is advancing all right, but the baby is not growing as it should in utero. That is one. And then it can also end the pregnancy abruptly, so the woman can go into preterm labor and deliver a preterm baby. We all know that preterm babies usually require specialized care, sometimes going as far as nursing them in the NICU. Medical assessment is important because it helps us to rule out pre-existing medical conditions which may pose a threat to pregnancy. In the case where these medical conditions are present, the couple are helped in that the conditions are managed to the point where they no longer pose a threat to the pregnancy. If it is found out that it is unsafe for the woman to carry pregnancy because of the medical condition, they are counseled against such. There are also some medications that are teratogenic, which means they disrupt the formation of the baby in utero. If either of the couple is found out to be on such medications, they are referred so that either the medication can be discontinued for the period they are going to become pregnant or changed to a safer one. The couple is assessed for psychological and behavioral risks that may pose a threat to carrying the pregnancy to term. For instance, spousal abuse and or other forms of gender-based violence is referred to the social welfare or psychologist for further management. Alcohol intake, smoking, and substance abuse all affect the healthy development of the fetus. Couples who have this issue are taken through counseling and behavior changes to help them refrain from such activities. Sexually transmitted infections can also disrupt the development of the fetus in utero. The couple is screened for sexually transmitted infections, and in the case where either of them has an infection, they are treated before pregnancy commences. A healthy BMI ranges from 18.5 to 24.9. A woman who falls outside this range is guided through dietary modifications and exercise to help her attain a healthy BMI so that she can carry the pregnancy to term. The couple is assessed for rhesus compatibility. Rhesus is an antigen which is found in the blood. If you do not have this antigen, we say you are rhesus negative. And if you do have it, we say you are rhesus positive. In the event where a rhesus negative woman becomes impregnated by a rhesus positive man, her subsequent pregnancies are at a risk of becoming aborted because of this rhesus incompatibility. In this case, the woman is given a vaccine known as the anti-D during pregnancy and then right after delivery of her baby to protect her subsequent pregnancies from becoming aborted. Preconception care is not limited to the assessments discussed in this session. When next you decide to have a baby, do yourself, your partner, and the unborn baby a great favor by going to the hospital to have yourselves checked.